have Bill Goff, the CEO of Physical Health Insights, which is a startup to address muscle and joint conditions. Thank you.
You're looking at the original tech.
Yeah, all you have to do is look at my face. You know I've been around a while. This is my 5th startup, taking one of them public. Tonight, it's all about your health and the health of your family. So I'd like you to do something for me really quick. If your phone is handy, just lift it up and make believe you're looking for a new text, really quick. Anyone that's got their phone, and I'll look around. Okay? Yep. Get my clicker starting here. On the bottom one?
Yeah, right.
On the right side?
Yep.
Okay. Muscle and joint pain, why bother? 50% of Americans have back or neck pain, 400,000 visits to physicians every day. That's what the number is in the annual cost. The thing that's raising the physician visits most is a problem called certain kinds of neck pain. Now, it's got a new name. It's called text neck syndrome. I didn't make that up. That's been in existence since 2014. Not a lot of people know about it, right? Why does it happen? We did a 400-person case study on the app. And so when they came on the app, they can see any one of 16 major body regions. The app is all about finding out why you have pain, what you can do to help yourself, and when to see a doctor. And so 1 out of every 4 people that took of the 400 people there, actually what they basically did is said, I've got neck pain, not back pain, not any other kind of pain, neck pain. And so what you're really looking at is 25% of the mobile device people out there now probably have the neck pain already. We think it's probably closer to 60%. How are you going to handle that? We have an app. It's called Your Physical Health. Isn't that nice? Basically, this app allows you to make a judgment on any area that you have pain in any a part of your body. So you're basically selecting what male, female, where the problem is located, what the level of pain really is with the slide bar. We take you through a full range of motion movement. We do this whole thing in 3 minutes. And at the end of that, we're going to give you probable cause, what you can do to help yourself in self-care, help you prevent it, when to see the doctor, and the information the doctor needs. We have a complete healthcare solution. It's not just the app. The app puts the data up to the database. If you're really in trouble, we're going to take you through a full screening on the internet. And that's a lot more information, and we give you a lot more information back, and the doctor a lot more information. And you can come back later and use that to judge your progress over time. It's also building a database of information that doesn't exist anyplace in the world. That app could probably survey the United States in 3 days and have a risk profile of the entire country, every body region, every problem, why the problem's there, whether you're too old, or you're too young, or you don't do enough, or you're doing too much, or whatever it happens to be. Now, this is just an example of the start of what a full report might look like when you get to the back-end system, and you can see this on physicalhealthinsights.com. You can see all of the reports. This is what the physician report looks like. It's sort of in a way you say, well, what is that? Well, those are the areas. One in the top is medium risk, the knee is high risk. On the side, the doctor has, well, it's average risk for the head and neck. The pain level is 4, the frequency is weekly, and the Y tells you the exact range of motion movement that's causing the pain. And you know what happens when it's the neck? The movement is neck flexion. I was saying, we know enough about you to be able to say, you have the pain, you have the movement that deals with the pain, you're answering a question later on that says you're constant or all time, infrequent user of mobile devices. That's enough to tell us you have text neck. The value proposition is to really take and go after the thousands of dollars in personal costs and millions of dollars for organizations? The answer is this system can help prevent it, reduce the physician visits, reduce the related costs and days of productivity, reducing the medical and claims cost. This is a recurring revenue business model in transaction fees, cumulative recurring because it's an annualized basis, and data analytics revenues. We're not a B2C, we're a B2B. We're not the natural distributor, people like Virgin Pulse, which is the largest wellness organization in the world out of Providence. They're the natural distributor for something like this. Or large insurance companies, especially the health and the property and casualty on the workers' compensation and disability side, to the people that are policyholders, to their own members. The management team and advisors, Dr. Mark Melhorn is the former chairman of the American Academy of Disability Physicians. He's the primary author from the American Medical Association on muscle and joint health. He's a physician. He speaks nationally to insurance meetings and to the nation. Tanya and I are serial entrepreneurs. I was former Executive Vice President of Insurance Systems Incorporated, which we took public. I was Executive VP of Agency Management Services, and I was the gentleman at CNA, at the time EVP, to actually sell AMS, which I did in a 8 o'clock meeting on the tarmac of Nashua, New Hampshire with Steve, and it was Marsh Risk Capital, and it sold. Steve basically said to me, "What do you want?" I said, "It's the same as before, $155 million. He said, "Who am I going to see?" You go with the Tisches every night for dinner, so just tell him about it, and let's get the deal done, and the deal was done that night. The business leaders are Dennis Jacasian, former chair of CNA, Dr. Peter Madras. He's the president of the Medical Development Group in Boston. He's a lecturer at MIT, and he's the gentleman who created the original heart machine. Dr. Larry Wilkinson is the chairman of the University of Kansas School of Medicine. So you got a lot of pros here. The financial projections are just our idea. We haven't gone out to raise capital. This has all been self-funded at this stage of the game. But we know we can do this with just a single distributor. We know which the distributor is, and we know we can do something else. What we'd like you to do is join us to spread the word. Try this app. It's in the Apple Store. I have little things here you can pick up one. It's called Your Physical Health. Let's go help the 1.2 billion people around the world who suffer from these conditions. And in closing, not too long ago, our children taught us to stop smoking. Now it's our turn to tell them what they can do, because our children start with teenagers. 8 hours a day on average they're using these devices. And what I didn't explain to you before is your head weighs between 8 and 10 pounds. When you lean it forward, like everyone did here, you create 50 to 60 pounds of pressure here. That's called arthritis, all right? It's the fastest rising cost that we have. It's becoming more the reason to see a physician. If you have headaches, it's from that. If it's the upper back pain, it's from that. You're spending too much time looking down like this. Your children, the children that are 8 or 9 or 10 years old or earlier than that, when they become teenagers, they will have permanent childhood arthritis, and like me after all these years, okay, a head forward position which cannot be fixed. The teenagers, they're around 8 hours a day, and I'm at the low level. And most of them at this stage of the game look like this all day long. They walk like this, they talk like this, they talk to their friends like that. All we need to do is change that, and it's really easy to change, and we show you how to do that in the app. Thank you very much.
Thank you. Thank you, Bill. Any questions? Awesome.
Nice presentation, thank you. I'm just wondering, is your pitch more about the diagnostic part of your app, or is it more the services end? Because if I have TextNet now and I'm not changing my behavior, dramatically.
Well,
It's
the
not gonna
reason
go
I,
away overnight.
yeah, the reason I ask you to get the app is then you'll begin to see the kind of information we're giving you to change that behavior. Actually, for TextNet, it's relatively simple. It's more breaking the tension, not doing it consistently for too long a period of time. We know everyone's going to walk around like this for a long time, right? It isn't going to be up like this. But what we also know is it's fairly easy to change that. And consider the app really the triage. It's a self-triage. You're triaging yourself. When you get the comprehensive assessment, this is much more than the triage. This is the top orthopedic physician giving you information back based on what you told this individual and what you can do to help yourself, including stretching exercises for that region, including nutrition if you're overweight. It's very, very comprehensive. And the ability to come back and take it later and measure your progress to see where you were before is what that's all about. So it's a full population health program. And it doesn't exist out there. Do we have competition? Yes, we do, but that's good. When you're small and you're starting, it's good to have competition. We started earlier, but we're 10 years in research to do this. We have people out there now that are using, that you can get online therapy. And so what they're doing is they're trying to figure out if you have the problem. Well, you do. You're getting into therapy because you have the problem. We want to be before that. We want to prevent it. We realize that's not going to happen right away. But what's the reason to do this? What's the biggest reason to use this app? Because you have pain. That's why it's going to be used, not before that. Except if you tell your children that, or if you tell your buddy that, or whatever it happens to be, that's how it's going to spread. It's not B2C, but it'll be spread that way. One last thing I'll give you that we're after. There's an organization called commonsense.org. These are the people that give out all of the health information to all of the schools in the United States. They're a who's who of getting things out children need. They don't know about this, and they're going to know about it. And I think we're going to see a lot of traction from that kind of thing. Yes?
Who pays for how do you generate the revenue?
Well, there were three ways. We thought we'd charge $2.99 for the app, and we quickly decided we need the app out there. We could literally, I mean, if everybody decided to put the app out there today, we'd have the database for the whole country in no time flat. NIH would be jumping up with joy. So we said, no, we're not going to do that. What we're looking for is a $12 annual fee for the people in the wellness programs, not the individuals out there. And these are all the corporations there, whoever provides these kinds of services. And the biggest money, frankly, is going to come from the data analytics, what we already know. I mean, just think about that. There hasn't been a study done about TextNet. You probably, I don't know, how many people in here have ever heard of TextNet? 1, 2, 3, maybe 5, okay? There's no study out there about that. So what did we do? In a 400-person study, what we're telling you, 1 out of 4 people, given the choice of doing anything, are telling you that that's what they have. Just take that, expand that to all of the different kinds of things that you have wrong with muscle and joint pain. And I'll leave you with one thing. Muscle and joint chronic care and disability is greater than all of the other chronic care and disabilities in terms of cost. For you, for the insurer, for the government, right across the board. And if you just extend this into that 260 million people that are looking at these phones right now, where do you think that's going? You want to talk about something that is just a dynamic that's going to explode? That's what's going to happen, because what is it, 8 years since we started doing this? Now we're getting into it's being done long enough to really make a difference. Imagine an 8-year-old child who's been doing it for 8 years when they're 16 and they still don't know anything about it. Come on. Any other questions? Any other questions? Gentleman in the back. Yep, you with the hand up.
My question though is, if you're literally giving folks advice on how to change behavior
Yeah.
in order to fix your text neck, but you're actually, to get the advice, you're adding to the problem. Because you're going through an app.
No, I mean, you could take the approach that you're bending your neck over still. I understand that. I understand that.
No, so in other words, your delivery channel of this great information,
Right.
maybe should change my behavior instead of looking and discovering things and solutions by creating more text neck. You should, right? You should advise on getting that information in a different channel. Otherwise, you just continue to add to the problem.
No, really, getting the information out, you get the information out first, and then you have to get the information out to the influencers. But if you think that if you learn something that you can help yourself with, and that's going to make you worse, then I can't help you. You know,
Well,
it's that simple.
Many people have said that. All right.
Yeah.
Thank you, Bill. Appreciate it. Grand honor applause.